Hello, my name is Deanna Dixon, and I will be completing an mock assessment for my Laternal Psychology course 5153 Psychopharmacology. So, disclaimer, this is not a real case study, this is only for a homework assignment. Now, according to the case study for Maria, just a brief summary, Maria has come in complaining about feeling depressed in mood, recent shift in her activity level, feeling lethargic, not wanting to get up and get out of bed to go to work, a lack of interest in her previously pleasurable activities. She used to be a runner. She doesn't want to go do anything, any hobbies of that sort. She complained about just poor self-image, and just having a high stress response to her job as of lately. So during her assessment, we completed a biopsychosocial spiritual assessment, along with administered a depressive anxiety stress scale assessment to further address her complaints. Now, as far as her biological assessment, Maria did not indicate any type of previous medical complaints. She identified gaining an additional 15 pounds within this past calendar year. She denied having like any type of chronic illness or anything of that sort. It is helpful to know when her last physical was so we can further assess and make sure that medically she is okay and that there is no pre-existing comorbid diagnosis that we need to take in consideration when dealing with her mental health. Furthermore, socially, Maria is a 35-year-old Hispanic woman who has been married to her husband Jose for the past 10 years. They have two young children, two young boys, age 4 and 7. Pretty active family. I mean, her and her husband, make it a point to go out to date night at least once a month. And her family is also supportive in watching the boys whenever necessary. They just have a good, stable, wholesome, holistic household. They do carry their faith and their religion pretty strong to heart. She confirmed that she is a active Christian, so they go to church regularly. Excuse me. And she is most comfortable with practicing her faith in all areas of her life. As far as psychologically, Maria did indicate that there's a previous history of depression from her youth. She was able to identify around age 14 the first time she experienced any type of depression, possible reactive depression to break up from her childhood boyfriend. She does indicate that she was placed on antidepressants for a short duration of about 7 months. She was unable to identify the specific medication that she was on, but it is also helpful to know like how she responded to the medication. So we would definitely like to kind of dive into that a little bit more. She also reported a repeat depressive episode when she was in college, where she just had that same type of lethargic, fatigue feeling, did not get out of bed for at least a week. Maria did not disclose any specific stressors or triggers for her depressive episode while she was in college. However, she did indicate she just did not go to work or go to school during that entire week, and but eventually she got over it without any help of medication or antidepressants. She denied any history of suicide attempts, any suicidal ideations, or any behavior of self-harm without the intent of suicide. Furthermore, Her DAS results, her assessment came back. As far as her scores were concerned, she scored 0 on her anxiety portion. She scored about a 15 on her stress levels, and her depression levels were about 34. So it did indicate that there was extreme severe depressive symptoms. It may be helpful to also administer a personality assessment inventory, just to make sure that we're honing in on those actual clinical symptoms, coming up with an accurate diagnosis, and getting further feedback on treatment plans that may be best suitable for her. Moving forward, just as a therapeutic approach, it is my suggestion that Maria would benefit from cognitive behavior therapy, or CBT, to help address any faulty self-images, to address any faulty thought patterns, to address any maladaptive behavior, and just kind of help her cognitively process any specific triggers or stressors that may be sending her into this clinical spiral of depression. Also, psychoeducation would be helpful for Maria to take time to understand and to learn more about clinical depression, so she could better have an idea of what it is that she's dealing with, and how healthy coping skills to deal with it, and how to better navigate through life with this specific diagnosis, including how to communicate that with her family, how her family can support her, that sort of thing. It is suggested that Maria stays in therapy for, at least 6 to 12 months, just to make sure that she's comfortable, make sure that, her depression does go into remission, and that she does learn the necessary steps to maintain that balance, learn how to actively identify those stressors, and practice those CBT techniques to keep herself from going into self-sabotage. The prognosis for Maria's diagnosis right now, major depression, is good. I would suggest, even with any antidepressants or anything additional, that she would be referred to psychiatry for further assessment. However, with her therapeutic approach of dealing with CBT, psychoeducation, and any additional approaches that we may find necessary, Maria will hopefully go into remission and be able to better avoid further debilitating symptoms at this time. That is my conclusion of the case study, Maria. Thank you so much, and have a blessed day.